Hello friends, welcome to Color Pencils. Today's video is all about creating an important awareness. Kindly watch this video till the end and please share your valuable feedback and corrections etc. Breastfeeding, wet nursing and human milk bank. Breastfeeding or mother's milk. A newborn infant's primary source of complete nourishment is mother's breast milk for a minimum period of 2 years. Breast milk or mother's milk is the milk produced by mammary glands located in the breast of a human female. A mother's first milk is called colostrum. It is thick and very nutritious food to the infants. It contains very high level of antibodies which are proteins that fight infections and bacteria. Mother's milk contains the primary source of nutrition for newborns containing fat, protein, carbohydrates and variable minerals and vitamins. It also contains the important factors that protects the infants from infections, inflammations and other health implications. Mother's milk helps in reducing neonatal mortality. Mother's milk also vastly contribute to healthy growth, neurodevelopments, strong immune system and healthy gut microbiome. Wet nursing. A wet nurse is a woman who breastfeeds and cares for another child. When a baby is born premature or hospitalized due to some complications, then wet nursing is practiced. If a mother of the newborn is not lactating or suffering from some ailments or under medication or disease infections, etc., then also wet nursing is practiced to nurture the baby for nutrition. In simple terms, when a woman nurses a child other than her own at her breast, this practice is known as wet nursing. Human milk bank. Donating breast milk can be traced back to the practice of wet nursing since 1800 BCE. Mr. Theodore S. Cherries of the University of Vienna conducted studies from 1902 to 1911 investigating different sources of nutrition and their effect on neonates. Mr. Theodor S. Cherries was a German-Austrian pediatrician and a professor at universities. He discovered and described the bacterium E. coli. His studies demonstrated that the breastfed neonates' intestinal bacteria was significantly different and lesser compared to neonates fed by other means. In 1909, Mr. Theodor S. Cherries opened the first human milk bank. In 1980, the WHO and the United Nations Children Fund insisted and maintained their position that donor breast milk is the best alternative to the mother's breast milk. Human breast milk acts as a substitute instead of formula feed. It can also be fed to toddlers and children with medical conditions that include preterm babies or gastrointestinal disorders or metabolic disorders, etc. A human milk bank or breast milk bank is a service which collects, screens, processes and dispenses by prescription of human milk donated by nursing mothers who are not biologically related to the recipient infant. A human milk bank collects and pasteurizes mother's milk using state-of-the-art equipment which is then stored for later use. In today's world, with the help of technology, vastly improved screening methods and standardization of procedures have made donated milk a viable alternative to mother's breast milk. The ability to pasteurize and store the donated breast milk is up to 8 months. India Human Milk Bank. We have a proud history of being the Asia's first milk bank. It was established in 1989 at Sion Hospital, Mumbai, India, under the leadership of Dr. Almeida Fernandez and is presently run by Dr. J.C. Monker, a famous neonatologist. Important general details. World Breastfeeding Week is observed from 1st to 7th of August every year. Experts in child healthcare are stressing on exclusive breastfeeding on all possibilities. If in case of non-availability of mother's milk, then the human milk banks are perfectly safe. During the pandemic, Sourcing milk from milk banks is safe during COVID-19. There is convincing evidence in preprint scientific journals that coronavirus is killed by pasteurizing using Holder pasteurization method. Holder pasteurization method is also called HOP, which aims to remove the potentially harmful germs by heating it to 62.5 degrees Celsius or 145 degrees Fahrenheit for 30 minutes and then cooling it back down to room temperature and freezing it. All standard milk banks routinely use the HOP method as they follow a strict 3-tier safety net protocols starting with precautionary measures during collection from donors. Holder pasteurization of donated human milk is effective in inactivating SARS-CoV-2. Journal reference. The description link is shared along. Milk donor. Feeding or donating one's breast milk to a needy child who are not biologically related to them is one of the most precious acts of kindness, and it equals you to be a living goddess. Donating is easy. If you are blessed with extra milk, you can contact the Human Milk Bank at your nearby hospital. They will contact and explain you the entire process, help you get medically screened and collect the milk. Benefits of milk donating. Donating milk helps prevent breast engorgement in mothers. Breast engorgement makes the breast firm and swollen. This makes it difficult for their own baby to breastfeed and also causes severe unbearable pain to the mother. Engorgement happens when a mother produces more milk than her baby drinks. In such cases, donating excess milk not only gives relief from pain but also helps and saves lives of many needy infants in the hospital. Donors' eligibility criteria. Donors whose breast milk can pose a risk to recipients are not accepted for donations. They include mothers who regularly use medications, with the exceptions being prenatal vitamins, human insulin, and thyroid replacement hormones. Those suffering from hepatitis B and hepatitis C, HIV, and venereal diseases. Those using tobacco products or having any severe medical illness. Now, COVID-19 has become one of the criteria. Donors who are tested positive for COVID-19, who are in close contact with a COVID-19 patient or illness suggestive of COVID-19 in the last 2 to 3 weeks could not donate milk. Awareness of wet nursing and human milk bank. World Breastfeeding Week is observed from 1st to 7th of August every year. Wet nursing is still considered a topic of social stigma. People generally shy away from discussing it with others. Awareness is very much missing, and so many myths and social stigmas are surrounded with our citizens of our country about 3 things: breastfeeding and its importance, wet nursing, role and benefits, human milk bank and its uses. Content and reference courtesy: Google, Wikipedia, print media, YouTube, medical journals, medical notes, and educational projects, etc. So friends, I hope that my sincere efforts in bringing you a very few important details about a neonatal life-saving and a valuable topic today. Now, it's all our responsibility that we promote and share this video and this message to one and all whom we come across in our daily lives in order to make a healthier tomorrow. Jai Hind.